CAO, Mike Jack. I want to begin by acknowledging we're on Treaty 1 territory in the traditional homeland of the Métis. Today we're going to be speaking about some of our measures related to our battle against COVID. I do want to just remind Winnipeggers that we have had, according to provincial public health officials, 34,477 cases of COVID to date, with sadly 812 losses of residents due to COVID-19. We are still very much in the battle against COVID-19, and we note right now that Winnipeg's test positivity rate is 1.6%, slightly up from a week ago, which was 1.4. Province-wide, the test positivity rate, we understand from provincial public health officials, is double that of Winnipeg right now, at 3.2%, up from 2.7% from last week. We also note that by and large, Winnipeggers and Manitobans are doing their part to get vaccinated. Winnipeg's vaccination rate is 86.4% for those that have received at least one dose, compared to a slightly lower rate province-wide of 83.6% for their first dose. I want to thank you very much for joining us today. It's good to see members of the media, some of you in person as well as those that are remote. I want to begin by commending all of those in our community who have been and continue to follow the provincial public health orders vigilantly and are doing their part. I also want to commend all of those who have got the vaccine to date in order to protect themselves, to protect their families, and to protect our community. This summer, we did have a brief reprieve from the 3 previous waves that we've experienced as a community. But as we watch around the world and in our neighboring provinces, we're reminded that we're still very much in the fight against COVID-19. There's more work to do as we continue to battle this global pandemic and the very real health effects that we're seeing in our community. This while navigating the significant financial challenges of a community that's largely done its part to follow the provincial public health orders. The vast array of City of Winnipeg services, these are incredibly important to Winnipeggers, and we're here to serve, but to do so as safely as possible as we continue to adapt to an ever-changing health environment. Since the recent provincial announcement that our provincial government will be working with their public service to identify positions that interact with the public and will be developing a targeted vaccination and testing program, our public service has worked with provincial public health officials to build our own enhanced procedures to help better protect the public with as safe an environment as possible. And while we're providing a safe environment for services today that follow all current public health orders, we know there's more that we can do to add more protection for our employees and our community. With the new provincial public health orders and the provincial request for organizations to consider mandating vaccines, we're once again looking to evolve our procedures. This will include the work well underway to identify the City of Winnipeg service areas that interact with vulnerable people. The public service will also be determining who is and who is not fully vaccinated, and then providing the public health information necessary and actual vaccination clinics to vaccinate even more of our public service. In the event that we still have unvaccinated staff in the coming weeks, we're looking at options in consultation with the provincial government for a testing program that will include an option for redeployment of affected staff who are unwilling or unable to be vaccinated. One thing I would just ask all Winnipeggers that have yet to receive their vaccines to please consider doing so as soon as possible. Obviously, it helps mitigate the risk of COVID-19 for yourself, for your family, and for our community. But I'm asking everybody to really think about our vulnerable residents. Right now, those include children under the age of 12. And even though you may feel that you're going to be okay without the vaccines, we want to protect children down that transmission line and mitigate the risk of transmitting COVID-19 ultimately to children in our community who aren't eligible yet to receive the vaccine. As we move forward with these changes, I'll reiterate that our service today meets all public health orders. Today's announcement is an additional layer of protection that will help us do even more to help protect not only the public but our valued employees as well. I want to thank the new Premier for the dialogue that I've had with him more recently on this and related topics. Also recent dialogue with Manitoba's new Health Minister for that dialogue. Provincial government has asked all organizations to consider a similar mandate. I want to acknowledge those in the private sector that have stepped up, that are instituting similar programs. We know the federal and provincial governments have announced that they'll be moving in this direction as well, and we're answering that call. We're all Manitobans. We have a role to play, and we're trying to do what we can as the largest municipality where the majority of Manitobans reside. What I would ask is that other municipalities follow our lead and that of other levels of government to consider their own mandates for vaccines. We will remain available and accessible to other municipal leaders, administrators, as well as elected officials to work collaboratively with them to discuss what's working and where we see challenges with what we're announcing here today. We'll also be reaching out through the Association of Manitoba Municipalities to offer that collaboration to other municipalities in Manitoba. We know we have an integrated health system in Manitoba. We're all affected by the health outcomes province-wide. We have patients we know that are served here in Winnipeg from other municipalities, and vice versa. We know patients travel to other places in the province to receive health care, and so we all are affected by each other's efforts to combat COVID-19. And so I'm hoping that other municipalities will also consider taking similar steps, and we'll be there to work collaboratively with them. With that, Mike Jack will now provide some additional details, and we'll both be available to answer your questions afterwards. Thank you very much, and merci, Miigwech.
Thank you, Mr. Mayor. I am Michael Jack. I'm the city's Chief Administrative Officer. Earlier today, we sent information to all city staff advising of a COVID-19 vaccine requirement for our frontline employees. Those defined within our program will be those who have ongoing contact with vulnerable residents, including children under 12, or those who are working in a high-risk setting with direct ongoing contact with the public. And so within that latter category, we're including those working in public safety, community protection, recreation services, public transportation, and other public-facing customer service roles. Want to communicate to everyone, including our staff, that implementing this vaccine requirement was not a decision we took lightly. It is something we have been looking at closely since vaccines were rolled out in this province. And we've had a cross-departmental team looking very closely, figuring out how best to build a program if and when the time came that was thoughtful and careful, respected all of our employees' rights, and respected any of the rules within our collective agreements. The decision was made ultimately to limit the vaccines to those working in frontline roles. Since the beginning of the pandemic, we have attempted to follow what the province has been doing, both with respect to the orders they issued and down to the most recently issued order focusing upon frontline employees. So we've done the same. We are, as a city, doing everything we can to keep our residents safe. We are still encouraging all of our employees and supporting all of our employees to get vaccinated, as Mayor Bowman has just said. This is just going to be one additional layer of protection on top of all the other measures that we have taken over the past 18 months to keep our residents and staff as safe as possible. We are continuing to require masks in city facilities. We are continuing to practice social distancing where possible, and we will continue to follow all of our other COVID-19 safety protocols in city-operated facilities. So over the coming days, we are going to be identifying the specific positions and roles that will need to fulfill vaccine requirements. Staff will be contacted directly if they are identified as needing to fulfill those vaccine requirements as part of their position. They will be given details on how to submit their vaccine information or how to access vaccine exemptions. There is still time for all of our employees to receive the vaccine, and still ample supply within Winnipeg and Manitoba for that purpose. Staff will be required to have a COVID-19 vaccine be fully immunized by November 15, 2021. So what this entails is that they will have to obtain their first dose no later than September 28, 2021, with the second dose being obtained no later than October 28, 2021. In the effort to continue to support and encourage vaccination among all of our employees, we will be setting up mobile vaccine clinics for employees. As you all know, we've got many city properties throughout this city, and we want to ensure that accessibility to vaccination isn't an issue for any of our employees. We will be doing that in the coming weeks. We are continuing to explore options for staff who are not vaccinated. That will include frequent COVID-19 testing or possible redeployment to roles that will not require contact with the public. During this first phase, this will be an information gathering phase in terms of what we are dealing with. We need to determine how many of our employees are not vaccinated at this present time. That isn't data we have been collecting, and therefore we don't have it yet. But in the meantime, we're going to continue to work with the province on the logistics of a COVID-19 testing program for our frontline staff that fall within this program. So that concludes my comments, and I understand you may have some questions. Thank you.
Mr. Jack, why did it take 3 weeks after the province announced its vaccine mandate for its public-facing workers to deal with vulnerable people for the city to follow suit with its own?
Yeah, no, that's fair. We've been having pretty frequent discussions with the province truly since the pandemic started, if not before. We were looking to determine whether or not the recently announced order might include our frontline staff. We have a number of relationships with the province, including our relationship with Shared Health, with our paramedics and firefighters. And so we were seeking clarification whether or not some of the order that they had announced was in fact going to apply to city employees. So once we determined that wasn't the case, we knew we were then going to have to develop a program on our own, certainly in conjunction with and trying to align as best we could with the province. But we then needed to finalize the work we were doing on our own program.
I'll just add to that, Bartley. There was a hope that the provincial public health orders would simply provide this mandate for all municipalities, if not even the city of Winnipeg. I had that dialogue with provincial officials in recent weeks as well. But in the meantime, and notwithstanding that dialogue with the province, our officials were having discussions with counterparts of the province, as well as trying to canvass some of the mechanics of how this would actually roll out. I know the federal and provincial governments have announced, but not all the details have been made known, and I think they're still working on it. And we're doing the same as well. I know there's a number of private sector organizations that have also been stepping up with similar mandates. Many others, though, have yet to do so. I'm not aware if any of the media outlets have mandated vaccines either, but hopefully they're considering making similar moves to answer the provincial government's call as well.
Federal government's probably mandated my organization as a Crown org. How many city employees are there right now? There 8,000 approximately. What's the number?
Well, there always is a distinction between employees and FTEs, of course. But if we're talking just employees, actual people who consider themselves City of Winnipeg employees, that's over 10,000.
Over 10,000. Right now, by basic math here, we've got about 183,000 Manitobans above the age 12 and up who are eligible for vaccines who have not yet had at least one shot. Ballpark, how many of those 183,000 are your people?
Yeah, I'm not going to ballpark that. I think what we're going to do in this first phase will be to get a much better indication of what we're dealing with. We think there's a high percentage, candidly, but again, that's just speculation on my part until we get that data.
Sorry, a high percentage of your employees?
We have every reason to believe that a high percentage of city employees are already vaccinated. But of course, that's anecdotal and that's impressionistic. We really want accurate data.
How practical is ongoing testing for unvaccinated employees, say, a year from now? Is this something that you would continue in the long term?
We're obviously hoping that all of our employees will choose, where possible and where they can, where they're not dealing with a medical issue, that they will simply choose to be vaccinated and thereby do away with the need to even consider that option. How practical is it is really going to depend on what we find in terms of how many employees are not vaccinated. It's not a program that exists currently at the city. I think you all likely know we don't currently have a robust testing program for COVID-19. So it is a capacity that we are going to have to build, but we're going to have to build it in proportion to really what we're dealing with in terms of numbers.
And did the city consult with unions on this, like the police and the firefighters, and how, if so, how did they react?
We did, and I did personally with a number of our union leaders as well. I don't want to go too much into detail other than to say I felt I received positive feedback from the discussion. Some union leaders, like the leader of the United Firefighters of Winnipeg, have made public statements in terms of demonstrating their support for vaccines being mandatory within the workplace. So we had a number of discussions. I really would have liked the opportunity to have even more engagement and dialogue with them as we built this. That is difficult. It's difficult to put a program together by committee, difficult across bargaining units. What we are going to be doing, particularly subsequent to this announcement, we still have parts of this program that we're building, frankly, and I want to engage directly with them and continue to do so. I think we'll all be better if we focus on putting together a program that respects all of our employees and trying to minimize any of the conflict that we might have as we develop it.
I would like to go to the media that are on Zoom. So Mike from CTV, do you have any questions?
No, I don't have any questions. Thank you.
Okay, thank you. Rosanna from Global, did you have any questions?
Hi, yes. I was wondering, are counselors a part of this this vaccine mandate?
No, this program that we're discussing this afternoon is being issued under my authority. This pertains and only applies to City of Winnipeg employees.
Taylor from CHVN, did you have any questions?
Hi, yeah. For employees who are under the age of 18, are they still included in this?
That is honestly a good question that I don't recall us canvassing. Those numbers would be very small, but I know it's not the answer that is specific enough for you, but I know our human resources professionals would have considered that. We can certainly, through Felicia, undertake to get you a better answer today on that.
Thanks. And is 2 weeks going to be enough time to collect all of this vaccine information? I know some people were struggling to get those vaccine records for themselves.
We're hoping so. Yeah, we're trying to go, with as much expediency as possible here. So that is our hope and expectation that we'll be able to do it. It is, as you can expect, it's taking a lot of person hours, to mount this kind of effort and to put together a program like this, but we're expecting to be able to.
Thanks.
You can go back to the room now.
Speaking of the counselor bit, and how on earth is a city councilor not a public-facing employee, Mr. Jack?
We could get into, I don't want to split hairs on legal definitions, but we've determined quite long ago that city councilors are not city employees. They are elected officials. They hold certainly hold a very official role with the city, but they're not employees subject to my management.
Well, this isn't directly related to vaccinations, but there's a lot of cases where people are upset. They see public-facing workers, some of them police officers, not wearing masks, in doing something as simple as, you've seen the images of somebody buying lunch, but sometimes they're entering houses as a result of an emergency. What message, Mr. Mayor, do you have to city employees about the mask wearing?
About the mask wearing?
Correct.
Well, look, the City of Winnipeg took the lead last August to mandate masks in our spaces, in addition to other measures and requirements that have been made by the public service with respect to the staff Obviously, we're encouraging all Winnipeggers, including members of our public service, to wear masks where it's appropriate. And so that's something we'll continue to do.
My question is, however, what do you have to say to those city employees who continue to not wear masks when they are in places where they must be wearing masks?
If your question is where city staff may not be complying with city rules regarding masks or any other issue relating to COVID-19, obviously we want to see appropriate disciplinary measures implemented. And so that's fact determinant based on the specifics of a case. I can't comment on any specific instances, and I know that's not your question, Bartley, but obviously we are hoping and expecting that our staff, and the vast majority of our staff, I want to commend the city's public service. You know, our staff through each department, they have by and large answered the call to respond to the challenge of this pandemic, including stepping up and rolling up their sleeves and getting their vaccines and wearing masks. And in instances where folks may not follow the rules, obviously, you know, whatever the appropriate supervising and disciplinary measures that can be implemented, obviously I want to see that.
Will you make vaccination rates among the affected departments public as people continue getting vaccinated?
We're still looking at what kind of data we'll be able to offer up to the public. Bear in mind that this program is only going to apply to select employees. And so to come out with percentages might be a little misleading because some departments may have nobody that fits within this program. We are going to the extent we are able to, within existing privacy rules, existing collective agreement rules, we are going to offer as much information as we can within those boundaries.
And do you have potential exemptions to this in mind, like medical or religious reasons for not getting the vaccinations?
We are going to approach exemptions truly on a case-by-case basis. You've mentioned medical and religious, and those would be the two main categories that are often discussed. We have an occupational health section that deals with requests for medical accommodation and always has, and so they will still approach these on a case-by-case basis. And likewise, we will have access to a form if anyone wants to claim a religious exemption. It will be reviewed and analyzed, and we'll make a determination then.
What happens, oh, go ahead.
Sorry, if I can just add to that. I mean, this is where the dialogue with the province has been incredibly important. We know they're you know, fleshing out some of the details with regards to their own policy that they've announced previously, and so that's where I really want to thank provincial officials. Their accessibility to ours has been really helpful. And we know that they're moving in real time and doing the best they can to provide some of the similar answers to these very same questions we've been raising with them, and we'll continue to have dialogue with them to try to ascertain, you know, how they're going to actually implement some of these things as well on some of those finer points.
Are Transit Plus workers covered in this mandate?
We're looking at that closely right now. It is our intention to have this apply to such contract employees as well.
Now, contract employees in general, are they at the province? They are largely, if you're healthcare workers entering a facility, you might be a temp, you might work for a service. Is it the intention that all contract employees that are public facing and deal with vulnerable people are covered? Is that the spirit of what you're going for here?
That is the spirit of what we're going for. Obviously, there, you know, it depends what you're talking about. If someone's simply dropping off a package at a city facility, working for a courier company, that's a far different interaction than someone we've got working regularly in a city facility under contract. In that latter case, it would be our intention to make this apply.
Now, I know this is not a large number of people, but what about EAs for councillors?
Good question. And not only does this not apply to council, but it doesn't apply to their direct staff as well.
What happens if you end up with a large number of people within a specific critical skill set that decline to be vaccinated? For example, I don't want to speculate examples because then people will think I'm basing that on something, but what happens if a specific skill set that is of critical need to the city, you get a large group of people that just go, no, not going to do it?
That is an important question that we've talked about a lot. The need to provide service, effective and reliable service to the residents of Winnipeg has to be paramount. And so we're not prepared to jeopardize that for a workplace policy. What we are hoping and expecting, what we're going to work towards, is ensuring that doesn't occur, ensuring with encouragement, with education, with the offering of redeployment if necessary, and with a testing possibility, that we're not facing that.
And Mr. Mayor, you briefly mentioned your dialogue with the province. The interim premier has stated early on that you were one of his first phone calls. Was that accurate? And what do you make of the relationship right now between the city of Winnipeg and the province, given this stated intention to repair the relationship?
Yeah, it's been really positive. I've known the new premier for many years prior to both of us entering public life, and certainly appreciated not only the phone call but having him open his door. I think I was one of the first, if not the first, meetings that he had with a public official, and so really appreciated that dialogue. We've enjoyed a really collaborative relationship in his previous portfolios as well. But the one thing I would say is that the dialogue has been very collaborative, especially where a lot of the work happens on a day-to-day basis between our officials. And that's something that has really helped with today's announcement. And we're going to need those lines of communication open as we move forward with both provincial as well as federal officials.
Are we in political questions now?
If you're done with COVID questions, we can always shift.
Let me double check. If anyone on the Zoom call has any more COVID-related questions, unmute your mic. Otherwise, I will assume that you are good on COVID.
I just a quick question here with Global. I was wondering, the province has said it would use rapid testing, so are you going to be relying on that for your testing?
We're still looking at exactly what will be available, and again, it all starts with this initial phase of determining even what kind of program we need to build based upon our numbers. So when it comes to testing, perhaps the easiest answer is that all options remain open, and we're continuing to explore how best to do this.
All right, if Zoom participants are good, we will let Michael, Jack go and leave the mayor for everybody else.
Thanks, Mike. Thanks.
Mr. Mayor,
Nice to see you in person.
yeah, it's great.
Sorry, this is the first time in, I think, a year and a half that I think many of you have been here. So welcome back.
Thank you.
It's nice to see you, even above your masks. Yeah.
Sir,
Sorry to interrupt you,
yeah,
James.
sir, where is the city at right now in terms of working with Gem Equities to expedite the Parker Lands development? Is there any new developments in the public service on that?
You know what? I couldn't give you an update. I haven't received an update in some time. The last time was when council received an update. And so I couldn't give you the latest, but that's a question really the public service could hopefully update you on. Obviously, we want to see things proceed as much as possible.
Sure. Are you privy to the court case that's going on right now? Gem Equities is suing the city for $30 million.
Yeah.
Any updates on that?
Well, it's a matter before the courts, and so I'm going to defer comment on anything that's before the courts right now, other than to assure Winnipeggers that we have and we will continue to vigorously defend the interests of taxpayers.
You look at the Tory leadership race right now, and do you say to yourself, gee, maybe I should have gone for that?
No. You know what? I jokes aside, I do want to thank all those that have reached out in recent weeks. I've had a lot of very flattering calls and messages conveyed upon me that has been very much appreciated. And I want to wish all those that are running all the very best. We always want the best for our province, regardless of which party's in, regardless of who's serving in those roles. I am honored to serve as Winnipeg's 43rd mayor, And, this is a mandate that I take very seriously. It's the one level of government right now that isn't in political flux. And so I think there's tremendous value without, at one level we have a federal election, and the other we have a race to see who's going to be the next premier, especially during the pandemic. Having at least this level with a little bit more stability is something that I think is tremendous value right now.
We've spoken about city finances recently.
Yeah. It's not balanced yet.
Right. We all know where it's at, more or less.
Yeah.
What's the solution, and what's the plan going forward to get revenue coming in? And I realize there's a pandemic going on at the same time.
I mean, indirectly, that's what today's announcement is trying to do. All of the measures that we're doing as a community to combat COVID-19 is part of getting back to, the new normal as quickly as possible. And so, the health effects, they do affect our finances as a municipal government, but also the finances of private sector businesses. And so one of the ways in which we get back to some normalcy and also restore some of the revenues that we need in order to operate critical services for our residents is to combat COVID-19. So they are related. Obviously the answer to how we're going to balance our budget in terms of this balanced budget update will be answered when we table the budget in the coming months. And we've got some work to do. But the one thing I will say, and I think I mentioned it to you earlier, James, last week, is that it really will be a multi-year recovery. We don't anticipate our revenues will just rebound overnight. Even if the fourth wave is our last wave and it's over within the coming weeks, we know that this is going to take some time. Transit revenues is, of course, one of the big drivers. We know our parking revenues are down. The financial report that was published, contains some of those details. So we do have a lot of work to do. And I guess what I would just say is these revenues are important, not, for the main reason of these are the revenues that we rely upon to provide critical services to our residents that they need from the moment they wake up until they go to bed at night. So, clean, safe drinking water, I know that's utility, but, all of the services that the city provides, they take revenues to operate.
Are you comfortable potentially dipping into the rainy day fund to help the bottom line?
We'll answer that question when we table the budget, but these are the exact questions that we'll have to answer as a council when we're deliberating the budget.
See, normally at this time of year, you see a big deficit projected, then as,
Yeah.
the various departments do more detailed reporting towards the end of the year, you find out that they didn't spend their money.
Yeah.
And last year, despite a similar forecast, you got into a tiny surplus situation. So how confident that you can do that again?
Not. I think, the finances, this recovery is going to take some time. And so, yeah, we're not expecting that they'll just magically rebound in the way that I know you're alluding to, Bartley, in previous years. So I think it is going to be a difficult process. Yeah.
One of the more unexpected stories that we've seen throughout the pandemic amongst municipalities is an odd situation where municipal housing prices, residential housing, have continued to spike in spite of pressures on the economy. Some cities are weighing in heavily. Winnipeg has not had the pressures that we've seen in Toronto and Vancouver most acutely, but we still have upward pressure here. So when you've been speaking with your economist, what, if anything, has he said that is on the horizon in terms of housing policy to try to curb some of the either inflationary pressures or ensure you have enough stock for the people you need to move here to fulfill jobs and continue the growth that you talk about?
Nothing specifically to the point you're raising, Bartley. Most of our focus has really been on the affordable housing front and just trying to increase the capacity there because it affects the full spectrum of housing options for residents. Our housing stock has been pretty stable and growing in recent years. We saw the growth, the rate of growth of new residents slow as it did throughout Canada during the pandemic, when you can't fly here or travel here, that affects things. But you know, these and other questions, I have no doubt will be raised going forward. But you're right, the issues are less acute here as what we see and hear in places like Toronto and Vancouver.
And the flip side of my question is Manitoba's population only increased 4,000 people between end of Q2 2020 and Q2 2021. Very little growth in Winnipeg, and Winnipeg has relied on new additions to the tax base, more so than property tax increases. 2.33% barely touches inflation, really. So what effect has the lack of growth here had on your economic forecast?
Well, our economists would be better suited to provide you with some more specific responses. But yeah, I mean, obviously, more growth in the number of residents is something we want to see, and we do expect that will rebound and spike up again, as it's been on a very positive trajectory over the last number of years. And that does help. I mean, it helps on a number of fronts. It helps with our labor force in terms of having skilled employees to fill positions that we know are available here. But it also does increase our tax base. But that's not that's not the ends that we're looking for. We're looking for increased economic growth and activity, and increasing customers for the existing businesses that are here. And so we expect, like other Canadian cities, that now that we see an easing of international travel and other things, that we'll see that reflected in our numbers. But it is impressive that we have continued to grow during the pandemic to any extent, let alone reduced rates that obviously we are they're going to pose a challenge.
Transit ridership is very low right now. Do you think that's a fear problem, or do you think it's an economic issue? What's going on there?
It's interesting because I've had this discussion with other mayors, and it's a similar dynamic in other cities. I think part of it is just folks are still staying close to home. I mean, if you look at even some of our downtown towers, there's a lot of businesses where people are still working remotely and aren't traveling as a result. And that's something that's just reflective of the fact that we're still in the pandemic. I mean, we are entering a fourth wave. We see what's going on. You look at the numbers in Saskatchewan and elsewhere right now. We see the uptick in the test positivity rate here in the province of Manitoba as well. We are still, I think it's reflective of the fact that we're still in the pandemic. We're not done yet. So nobody should be putting a mission accomplished banner up anytime soon, because we're not through this yet.
Councillor Gillingham, I think yesterday, said you guys were working on an economic development recovery plan. Do you know when that's going to come out, and how has it been like? I just imagine it would be really hard to make when COVID is still going on. So has that fluctuated? And yeah.
I'm looking forward to seeing the report when it's ready. I know the dialogue has been pretty robust with third-party stakeholders, as well as obviously within the public service. And so, I can't give you an exact timeline right now. I think it is expected in the coming weeks, if not in the coming months. And so we can get you that information today. But it is still something that we need to be planning for right now. For a couple of reasons. I mean, firstly, the affected businesses in our community, anything we can do to provide that support to them in terms of their own recovery. I mean, they've been hit very, very hard. We're talking obviously about the municipal government's finances, but the bottom line for a lot of businesses has been really negatively affected as well. And so that work is important. It's also work our deputy mayor was tasked to help provide some oversight and guidance in terms of just the overall long term. We've looked at short term options. Active transportation has been canvassed a lot by media, but what are kind of the long term improvements to city services and city building that we can take, as well as that economic recovery, is part of that work as well. We don't limit it to 10 questions here, so you can keep going if you want. But you guys good otherwise?
Yeah.
Okay.
Reasonable, yeah?
Yeah,
Anyone
nice
on
to see you
the
guys.
Zoom call that,
Oh, sorry.
Just want to give one more
Yeah,
opportunity
sorry.
to Zoom participants. I think we're good.
Okay.
Now, before you walked in, we were just talking about Norm MacDonald.
What were you saying?
Oh, he passed away.
Yeah,
Norm MacDonald,
I didn't know that. Oh, I'm sorry to hear that.
cancer, 9 years.
Oh, I'm sorry to hear that.
Yeah, it was just, it's only.
Yeah. We've lost quite a few good people in our community recently.
If you saw my eyes right when you said the only level it's not in political flux, you may not be in political flux, but because you're not running again, there are people who want your job, therefore there is a degree of political flux.
Yeah.
You can't, you don't have to govern in your final year the way you would if you wanted to be elected.
I would argue that. I don't know, because I didn't assume that I would win re-election anyways. You don't make those assumptions, so you have to presume you're only in for 4 years and do what you can while you're in the office. So in terms of my own actions, not judging by the actions of others who may be positioning to run, which I'm glad people are giving it thought. It matters, so.
If you didn't care, well, obviously you didn't say you didn't care if you were reelected, you just did this thing you did. Just wondering if you could read New Portage in Maine.
That'll be in my book that 10 people will read.
Oh, have you,
I'm not writing a book. I'm just joking.